Okay, Assalamualaikum and hi. I'm Dr. Nur Liyana Binti Hamid. Today I would like to present my literature review on the topic relationship between gingivitis and pregnancy. Okay, so let's start. Okay, so for introduction, mostly pregnant women, based on the study shows that most of the pregnant women will have around 60% to 70% will having condition that called a pregnancy gingivitis. Okay, so actually, what is gingivitis? Gingivitis is a condition where there's an inflammation of the gums that is caused when the plaque accumulation in the space between the gums and the teeth. Okay, the accumulation of the bacteria can lead to loss of bone around the teeth and can eventually lead to tooth decay and tooth loss. Okay, there's a few signs and symptoms of the gingivitis. One of it is bright red and purple gums. Okay, tender gums that may be painful to touch, bleeding from the gums when brushing or flossing, halitosis or bad breath, inflammation or swelling gums, as you can see in the picture. Most of it are swelling and there are redness or purple gums. Okay, receding gums also, and last one is soft gums. Okay, so now I would like to explain skin that shows tell how change of hormone will affect the pregnant woman. Okay, so basically when the woman get pregnant, there will be a change of hormone in their bodies. Okay, the hormone that I mean is called estrogen and progesterone. Okay, when someone is pregnant, the level of estrogen and progesterone will increase. Okay, with the help of the accumulation of plaque in their mouth, will mix cell lymphocyte will decrease and the bacteria P intermedia will increase. Okay, with the combination of all the things, it will make easily pregnant woman to be affected in pregnancy gingivitis. Okay, so here is another example of picture of gingivitis. As you can see that there is redness around the cervical gingiva. Okay, for the treatment for the gingivitis is only a scaling and root canning. Okay, as we can perform from week 8 without increase the risk of pregnancy. Some of the cases we need to do gingivoplasty or gingivectomy, but then if it's really required and if the dentist really advised. Okay, both of the treatment can only be done after the pregnancy period itself. Okay, as for the discussion, okay, so mostly my literature is going to explain how the development gingivitis to the pregnant woman. Okay, as I mentioned before, there's two important hormone that play in big roles how the gingivitis will happen. Okay, so the principal estrogen plasma is stridor. Okay, estrogen is produced by ovary and the placenta itself, and progesterone is secreted by the corpus luteum, placenta, and adrenal cortex. During pregnancy, both of them are elevated due to continuous production by the corpus luteum, and at the beginning and the placenta afterwards. Okay, by the end of the third trimester, progesterone and estrogen will reach the peak plasma level of 106 nanogram per milliliter respectively, which are 10 and 13 higher times level observed during the menstrual cycles. Okay, for the immunological changes have long been considered also, at least in part responsible for the parental condition observed during pregnancy in the various immune mechanism in the process of gingival inflammation that we call polymorphonuclear leukocytes or PMNS are the primary effector cells and appear to play a major role in this gingivitis situation. Okay, when they're stimulated by bacterial pathogen, host cells release pro-inflammatory cytokines as part of the immune response. These cytokines will recruit PMS cells to the site of infection, and then it will release a variety of toxicoactive products such as chemokinase, proteolytic enzyme, cytokinase, and reactive oxygen species ROS. And thus indirectly it will contribute to the increase of gingival inflammation. So basically, it's how the process of gums inflammation is. Okay, here is another example of the gums condition inflammation or gingivitis in pregnancy women. Okay, so as a conclusion, majority of the pregnant women were unaware about development gingivitis during their pregnancy period. Most of the women did not know about various measures of the prevention and the treatment of pregnancy gingivitis, and most of pregnant women did not visit the dentist during pregnancy. Okay, so here is my reference. Okay, as you can see here. Okay, and this is my team, our team. So as you can see this picture, I am Dr. Liyana as a presenter and the first author, and my partner, second author, Dr. Muchara Anissa. Okay, so that's all for today. Thank you.